So this particular article, really an interesting one. And does it apply to our practice? Well, in my mind, the question should always be, how does this apply to me? And you guys, the operational medics, did a really great job, I think, kicking me in the back a number of years ago at SOMA, because it was really, as a young AMED officer supporting you guys, it's kind of directionless. And somebody said, yeah, well, it's really easy. You just ask yourself, how does whatever you're doing support the operational soft medic out in the field? And that is a really easy mission set and guidance to take. So for this particular article that you chose, it is talking about hyperkalemia or high potassium in CPR. How does this apply to me? Well, all we've been talking about for GWAT for 20 years is trauma, which is a etiology of losing too much blood, or hypovolemia. And I think we all know, and it's been well documented, that trying to pump a heart that is empty of blood should essentially be considered futile. If your patient doesn't have a heartbeat because they've lost blood, then the answer is give them more blood. And oftentimes that heart will spontaneously resume function. But as a number of folks in the community keep foot stomping, something like 50 to 80% of people who are taken out of the fight, depending on the fight, are from disease non-battle injury. And so those are medical causes of injury, including CPR. So does medical CPR apply to you in your practice? I don't know. You think so?
I mean, is it futile? You're talking on the battlefield, bullets flying. Yes, it's futile. You don't have the time nor the stuff to focus on this. You're at camp, or you're at your base or FOB. There's no danger to spend some time. And some causes are reversible if you assess and attack your H's and T's. Ultimately, could it be futile and the patient passes? Yeah, it could, but you could win. And is it worth 20 minutes of sweat, a couple of vials of an easily acquired medication to use on this human being who's on your side? I think in that case, yeah, it's worth it.